Hi, my name is Carrie Lewis, and I'm going to be performing an informative speech on the benefits of hand washing. These are the 3 visual aids I'll be using today. The Joint Commission is a healthcare company that comes up with a yearly list of national patient safety goals that are intended to help improve patient safety. Number 5 on the list for 2015 is hand hygiene, recommending to implement hand cleaning guidelines to help battle preventable infections. Proper hand hygiene is the single most important, easiest, and least expensive means of reducing the prevalence of infection and the spread of antimicrobial resistance. Yet adherence to proper hand hygiene is almost abysmal, according to the Centers for Disease and Control. Multiple guidelines and strategies are recommended by the CDC and the World Health Organization to increase the adherence rates of hand hygiene. Hand hygiene is the most important infection prevention and control measure among patients and healthcare workers. Proper hand hygiene is inexpensive and benefits all health-related populations. If performed correctly, hand hygiene reduces the transmission of microorganisms and decreases the incidence of health-associated infections, according to the AORN journal, Back to the Basics. This form here is just to give you a general idea of the different types of bacteria and viruses that you come in contact with on a daily basis. Through research and evidence-based practice, evidence supports that a failure to wash hands appropriately is the leading cause of the spread of multi-drug resistant organisms. Nurses have an 80% contact rate with patients. The CDC recommends that healthcare workers should wash or disinfect their hands every time they have a contact with a patient, as well as upon arrival to work, before and after wearing gloves, after touching a contaminated object or removing personal protective equipment, before and after using the bathroom, when their hands are visibly soiled, and before and after eating. That in itself is a lot of hand washing. Not only healthcare workers, but the normal population should be more consistent with hand washing, and the techniques they use should be correct. Everyone washes their hands when they are visibly soiled, bloody, sticky, or perceived to be dirty. But what about all the other times we overlook washing our hands? Think about how often you clean your hands. When you shake someone's hand, when you give them a hug, when you touch someone else's belongings. Typically, we don't wash our hands after these types of contact. These types of contacts shouldn't be overlooked, and some form of hand hygiene should be implemented to help reduce the risk of transmissible infections. Hand hygiene guidelines established by the Centers for Disease and Control and Prevention require healthcare workers to disinfect their hands before and after every contact with a patient or a patient's environment. However, many employees do not follow these guidelines, leading to healthcare-associated infections that drive up the healthcare costs, length of hospital stay, morbidity, and death. As quoted on the CDC, hand hygiene in healthcare settings, in the United States, hospital patients get nearly 2 infections every year. 2 million, sorry. That is about 1 infection per every 20 patients. Infections that patients get in hospitals can be life-threatening and hard to treat. Typically, washing hands should only take about 20 to 60 seconds. According to the World Health Organization, healthcare personnel can use alcohol-based hand rubs to sanitize their hands if they are not visibly soiled, but should use an 11-step hand washing process to ensure that their hands are properly cleaned if visibly soiled. This is a small little diagram to show you what the normal person can use, an 8-step technique to wash their hands correctly. Generally, when the hands are not visibly soiled, or after touching a doorknob, removing gloves, or touching a patient, an alcohol-based hand rub should be sufficient in removing transmissible microorganisms that can become pathogenic. Correctly using a hand rub should take about 20 seconds, and special attention should be made to the areas that are frequently missed while washing their hands, such as between the fingers and the thumbs, the backs of the fingers and hands, and under and around the fingernails. These are the most common areas that people miss when they're washing their hands. The fingernails, between the fingers, the palms of the hands, the wrists, and the back of the hands are commonly missed. However, if visibly soiled, a thorough hand washing process should begin, which lasts about 40 to 60 seconds. These techniques should help to drastically reduce the number of healthcare-associated infections. Hand hygiene practices can be affected from habit, cultural norms, and lack of knowledge and operant conditions. Throughout the healthcare system, increases in workloads, understaffing, limited time, lack of role models, poor organizational policies, disagreement with protocols and guidelines, peer pressure, and conforming to social norms are continuous barriers to the compliance with hand hygiene and infection control measures. Education also plays a significant role in adherence to hand hygiene protocols. Among nurses, a lack of awareness and scientific knowledge regarding hand hygiene is considered significant, as well as the lack of proper infection control during schooling, training, orientation, and peer shadowing. Interestingly, many nursing research data supports that nurses' attitudes and culture at work have a great influence in clinical development, and it's a product of habituated behaviors. Hand hygiene is a socio-cultural phenomenon that occurs at the intersection of individual habit and the cultural norms of the facility. Operant conditions affect every aspect of infection control. Lack of hand hygiene products and centrally located sinks play a major role in poor hand hygiene. The introduction of and readily available access to alcohol-based hand rubs, sinks with running water, and antibacterial soaps increases the compliance with hand hygiene. The World Health Organization recommends that an alcohol-based hand rub be centrally located along hallways and outside all bathrooms in all public areas. Even if soap and water is not available, an alcohol-based hand rub can help curb infection and reduce infection rates dramatically. Today I have informed you of some of the benefits of proper hand washing, detailing the importance of hand hygiene. To improve hand hygiene measures, the above simple implementations should help increase adherence rates and compliance with proper hand hygiene protocols and help to decrease the amount of healthcare-associated infections.